Thank you. Hello, Ify.
Hello.
Hello, Ify. What's your question?
Yes, my question is this. I have someone that has been on this problem seizure for the past 28 years now. Yes. Doesn't mean that there is no cure for it at all. There is no. That doesn't mean that no. I mean, there is no cure at all. Because he has been living on this for the past 28 years. So please, I want you to enlighten me more on that.
Thank you, Ify. You have mentioned that some stop by themselves, but some people are on medication for life. Is there a way whereby a doctor can tell, I mean, following from Ify's question, whether it's the type that's going to stop? Because she's talking about someone who's had it for 28 years.
Okay, so there are some, like let me take the example of the juvenile myoclonic epilepsy, for instance. It occurs within the juvenile age group. That's one. Two, the presentation, the clinical feature, the phenomenology is distinct. So when you see that and you make that diagnosis, you are telling yourself that, wow, I expect this patient to outlive this condition. Okay. But most epilepsies are lifelong, and then they require treatment for life.
But can the person, you said the seizures can reduce.
Yes.
How normal a life can someone live thinking, you know, there might be a seizure? Just a minute, we're getting a phone call. Let's quickly take that before we go to answering the question. Hello.
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 Hello, we can hear you. What's your question?
Okay. Good afternoon.
Good afternoon.
Sorry, with the topic that you people are treating now in epilepsy.
That's right.
As it is, can epilepsy be contacted from maybe somebody that is suffering from epilepsy, like hepatitis?
Okay, thank you very much. Thank you for that one. That's a good one, because people are worried also that if somebody is having an episode, anybody around that person could catch it. Can that happen?
So that takes us back to the definition of epilepsy. It is a disease of the brain. It is not communicable. So you cannot transfer epilepsy from one person to the other by touch, by intimate contact, by contact with saliva, by contact with anything. It is a disease it cannot be transferred.
Okay, that settles that on that score. So we're talking about people driving and all that. But I want to ask you, does an attack affect the breathing of somebody? Does the person stop breathing when there's an attack? Because, I mean, why should the person be barred from swimming, for example, or bathing in a tub?
Epilepsies, like I said, are divided into two types. So there's this generalized type, and then there's the focal type. So in the generalized type, there's usually loss of awareness or loss of consciousness. So if somebody loses consciousness in a swimming pool while he's having a seizure, of course, that's catastrophic.
So he could take in some water.
Of course, he will drown. If somebody is cooking in the kitchen and has a seizure and falls over on the cooker, of course,
yes,
that's barbecue.
I hadn't thought of that. Yes.
If somebody is taking the bath in the bathtub and has a seizure, they fall backwards and probably injure themselves. Yes, with generalized epilepsy and some other complicated forms of focal epilepsies, people can lose consciousness and then there can be problems.
Okay, that brings me to the question I asked you before this one about how normal a life the person can live. Must there always be somebody with them?
Thank you very much for that question. People with epilepsy or people living with epilepsy can live absolute normal lives. They can achieve their dreams. They can achieve whatever they have set before them. A few days ago, I was watching a program on TEDx, and then there was this gentleman, Daniel Pruis. In short, is the current British ambassador to the Philippines. He was talking about himself and life with epilepsy. He was diagnosed with epilepsy when he was Deputy British High Commissioner to Spain. And then, for more than 10 years now, he's been with epilepsy and he's living a normal life. He's carrying out his diplomatic responsibilities.
But he takes his medication.
But he takes his medication.
Thank you very much for coming. That's all we can take on the show. Thank you so much for all your insight. And thanks for joining us on the program and giving us all those questions. Have a wonderful day and a wonderful celebration. I'm Mary Alale Yusuf.